I hope this doesn't come across as a video about just staring at bottles of urine, because I'm sure there must be other websites where you can do that. So it's a fairly typical story. I went to see my own doctor the other day. I went in and I said, "Look, doc, I'm back to see you about that rash and that horrible discharge. I'm here again about my sore foot." And he said, "Well, could you just pee in this bottle for me?" It seemed like an odd thing to ask, given the presentation. Anyway, I'd studied medicine later in life, so I wasn't always a doctor. But every time I went to see a doctor, they asked me to pee in a bottle, and I never really understood why. So I thought I'd make a short video about the types of things that we look for as doctors in your wee when we ask you to pee in a bottle. It's what we call a near patient test, which means that we've got a sample kit here and we can do it really anywhere. I can take this to the patient, they don't have to come to see me to do it. So if I'm going out to visit them at home or I'm seeing them pre-hospitally with an ambulance service, I can use these to do some simple diagnostics. So I've got my sample kit. I've got some samples of urine, some of which are genuine and some of which are made up. Which we can, piquant, I think would be the term to use. The first thing to do when examining a urine sample is to look at it. And what I'm looking for is to see whether the urine sample is clear or straw coloured. And this is a really good example of a straw coloured urine sample. This is actually a genuine urine sample. And this is what I'd be looking for. The testing kit doesn't really tell us whether patients are dehydrated. So looking is the best way to check. If it's dark, they need to be drinking more, and we'll often see people when they're unwell, they go off food and drink, and that will make their urine darker. If you've been exercising a lot or it's been hot, actually if it's been cold as well, people lose their thirst drive, and actually dehydration is a real problem in polar and Arctic climates. I've seen urine samples that look a lot like this over the years, and this I would refer to as a turbid sample, so it's cloudy, and this would raise my suspicions that I'm looking for infection in the sample. If I used the testing kit and I found that there wasn't any evidence of infection after I'd used the testing kit, then I would send that sample off to the lab to have further tests done on it. Any clean receptacle's entirely fine for putting a urine sample in. I don't need that much. That's a sample bottle, and I need maybe a quarter of that full in order to run the sample appropriately. Often patients will turn up with a full jam jar or some other large receptacle full of urine. What we'll do is we'll go down to the workshop where I've made up a camera rig to show you how the testing works. So this is a fairly typical urine dipstick test kit, and it's just a cylinder tube with lots of urine dipsticks in it like that. There. So we'll take one of them out because we'll use that to test this sample of urine in just a moment. Different manufacturers do different products and they'll test for different things. So just so you know that I do suffer for doing these things, this is actually a genuine sample of my wee, but I've doctored it somewhat and put some extra things in it just for the purposes of this. So you shouldn't have glucose in your urine. It should be filtered out typically, but the only time you'll ever see glucose in the urine is if you're diabetic. Ketones, again, are another sign potentially of diabetes, and the byproducts of muscle, protein and fat are ketones. So if you're starting to burn those things, we may start to see ketones. So starvation may show up as ketones in your urine, and that might be because you're unwell and you're off your food. Leukocytes are essentially white blood cells, so that's the LEU, and that might indicate infection. So nitrites here can be an indication of infection. They're a byproduct of metabolization of gram-negative bacteria, especially E. coli, which is one of the most common causes of a urinary tract infection. Protein might indicate that your kidneys aren't filtering properly and you may have a proteinuria. Well, you will have a proteinuria, but it may indicate something called nephrotic syndrome or nephritic syndrome in your urine, which essentially means that your kidneys aren't filtering out protein very well, and so we're starting to see it in your urine. And ER is erythrocytes, so red blood cells, and HB is for hemoglobin. And you shouldn't have blood in your urine. So you can see in this one, the pH is 5, well that's normal. Lots of glucose though in my urine, so that's not great. All of the other ones are normal until you get down to this one, which is the erythrocytes, which are the blood cells. And that one's positive as well. So based on this, I've got glucose in my urine and blood in my urine. So that might indicate early diabetic changes with some end organ damage in my kidneys. But just to show you how simple the test is, I'll also run one now on the other sample, which I've got here in a jam jar. How lovely. And just to show you that actually the urine sample is normal. This is where I diagnosed myself with some horrible disease that I wasn't aware of. So there you go. You can see that the control that we put in, so this one here, which is normal urine, uncontaminated, that's my sample, so I'm very pleased to see that there's nothing showing up on there. Next to the sample that's had some glucose added to it, and some red blood cells. So that's all the things that this testing kit will show me in terms of near patient testing. There are lots of other things that I can tell from urine by sending them off to a laboratory though. The most common thing that I send urine samples off to the lab for is to check for infection. So I may see evidence of infection here. I may even treat with antibiotics based on that. But sometimes, especially if the infection isn't getting better, I want to know specifically which organism is causing the infection. And I'll send the sample off to the lab to have those tests done. What it can't do, despite what you might read on the internet, is it can't tell me what allergies you have. Just in the same way that cutting a strand of your hair off and sending it off to the lab isn't going to tell you really what you're allergic to, despite what the laboratories might tell you. So I am conscious that I've been wearing exactly the same clothes in all the videos that I've posted online so far. I would like to reassure you that I have got other clothes other than a green fleecy top and an interesting blue scarf.